In Australia, 1 in 6 couples has difficulty falling pregnant. According to a new study, the emotional and overall psychological effects of assisted reproductive technology are significant factors as to why couples discontinue the process. Over 20,000 patients' IVF data was analysed, and 16% cited emotional stress as their reason. The research concluded that there needs to be more support available for those going through IVF treatment. Sia Parsalidis did IVF for 11 years until she fell pregnant. She said that emotionally her and her husband John were suffering.
Each time you go to the doctor, they'd say that, okay, this is your month, you're going to fall pregnant. You used to live on false hopes, and each time the month came and there was nothing happening, then it was hard because you knew you've got to go back to square one, start again. And that was the hardest, I think.
The mother of 2 said that IVF challenged both her individual welfare and her relationship due to the stressful circumstances, which is why she looked for support.
I used to go on forums, pregnancy forums and forums to do with IVF, and we used to just all ask questions and just learn from each other.
In 2010, there were almost 62,000 ART treatment cycles performed in Australia and New Zealand. Of those, there were 12,056 births. Melody Shanks is a provisional psychologist at White Rose Psychology who addresses many issues with her patients, including IVF. She said that men and women have different emotional responses to the experience.
The woman in the relationship often experiences intense feelings like pain, anger, fear, which combined with the messages that it's her way of actually dealing with what's actually going on. Sometimes she can perceive herself, or others can perceive herself, as being dysfunctional or going crazy or just not coping with things. So that can cause a lot of anxiety and depression as well. Men find themselves in a position where, I guess regardless of how well they've been trained to solve problems, they're helpless in this situation. However, they can't make it better for themselves or for the woman, and as a result they sometimes give off messages in the relationship that the woman is being too emotional or too sensitive.
For couples, Melody suggests communicating openly with one another.
It will help to balance the intensity and to bring you closer with a deeper respect for one another.
For now, there are several counselling and support groups available to people undertaking IVF. This is Marissa Georgopoulos for The M Word.